here, and we're doing a two-part series because I've been seeing so much case study research in health services and policy research generally as a method and an approach. And the more I see it, the more I realize it's probably worth having like a two-part series on it, because I feel like there's so much complexity around it. And there's like pieces within case study method that we're going to dig into over the next two sessions. I'm going to be talking about just case study designs, just to kind of almost like level set us for the real conversation I think that we need to have, which is around analysis. And Adanam's on the call here. And so Adanam's going to take the lead at the end of November, the November Methods Monday, to talk about the analysis of case study designs. So Adanam, do you mind like putting your camera on just for 2 seconds so everyone can see you? If not, don't. Okay, there's Adanam's the lead of November. And so this will be recorded too. We don't know how many people were able to make it today, but we'll record this as well. So I'm going to start sharing my screen. And I know there's a lot of people here who know lots about case studies. So I wasn't sure like where to pitch this, and I wasn't sure who was coming. So I apologize if it's pitched too low, but I must confess, even myself preparing for this, it was helpful just to kind of go back into the methodological literature and just kind of remind myself where we're at. So today is level setting around case study designs. I said Vince, but I took the lead on this more than he did. So today I just want to talk about the use of case studies, talk about different types and the elements of case studies. And Adanam, no, you don't have to keep your camera on now. I just thought just to say hello, no pressure, but you're welcome to. Review 3 different case study designs. So what I thought I'd do is like pull from some of the work that I've done and some of students as well, and actually do a bit of a deeper dive into the methodologies. I haven't talked at all about the results because I'm going to leave that for Adanam and the analysis. And then I thought each of us could day to even think about some of the work we're doing and the different designs, different ways we might use case studies. I know we all know this, but I put this up almost just for my own self to see this again. And this is just from CHR. And when I think about health services research, and I think about the definition of like how much complexity there is in the definition of health services research, that is really why I see case studies as so well aligned. And I see, as I sit on review panels, so many case study designs coming through. I think because it makes so much sense, the way cases are bounded and the way how much health services research is contextual and needs lots of different sources and data. Oftentimes it's like more of like a realist type approach. And there's been another article I just found that's lovely, and I'll share it with everyone. It's really like the how and the why questions, like the context. It looks at like what's actually happening in the real world. And so especially thinking about like as programs get implemented, as systems change, like half of what we're wanting to understand is like, how do these systems change and in what way do they change? So case studies are a logical sort of lens, and they also use lots of different data sources. So I think, again, looking at complexity from looking at multiple data sources is great too. And I know we've got a few ICS people on the call here. And the reason why I think it works well also from like an ICS perspective, because, the large data provides one perspective, but I can see using large data, and Vince and myself are using ICS data in our evaluation of the OASIS program. And so each of the different apartment buildings will be looking at health utilization by apartments, or which we're defining as cases. So I think there's lots of ways that you can integrate like sort of almost like subtypes of data within larger case study research. So this is a great article for anyone who's really thinking, either they're coming at it from learning themselves, or if you're coming at it as a student, or you're coming at it as a PhD supervisor and want to have a collection of great resources. I found this article really, really helpful. And so Trisha Greenhall, you might recognize her. She's like really does a lot of work around like realist reviews and evidence synthesis. And so this is a great synthesis around case study approaches. And really what they ultimately said at the end of the day is that case studies are great for testing and developing complex interventions, analyzing change in organizations. Again, this idea to look at a realist evaluation, which is what works, how, why, under what considerations or settings. And this idea of looking at a naturalistic study of complex change. So, I think of all of the work that many of us on the call are doing. We're working in these complex environments. And I'll talk a little bit more about some of the environments and situations that I think case studies, even just locally from our like health system and region, we can be looking at. I also think case studies are great for students, PhD students particularly. Some might argue that they're too complex. Like there is a lot of data that you end up grappling with, and Adana will talk about that in the November Methods Monday when we think about like, what do we do with all of this data and how do we do it? There's the least amount of writing around the analysis component. But I think it's a great opportunity for students to really understand the context of research because it's bounded by context, which I'll talk about, but it also gives them lots of opportunity to practice what it's like to collect data of different types of data, to manage data, and all within, like, as long as you bound it in a realistic way, it's a manageable way to do a PhD and have a lot of skills that you gain from it as well. So I'm not sure how many people are familiar with this, so I apologize if you are, but again, it was good for me as well to go back and just remind myself, like, I typically, and this is an old yin book, but I typically use the yin approach. I just sort of state that from the very start. I have read and gone through Stake in quite a bit of detail. I'm much less familiar with Miriam, who's from education, but I'll just raise it here because these are the three big methodologists in case study research. So if you are new to case study research, or even if you're an expert, it's worth going and checking all three out. Each come at it in I'm going to say quite different ways. I would say it's kind of like the three bears. So you've got Stake, who's very, very, very qualitative and much less descriptive in his approach. He even describes research as kind of starting whenever you decide you're ready to start is when the research starts. Whereas you've got Yin, some would call him a post-positivistic researcher. I would say he's more sort of pragmatic myself, and he is much more thinking about like meticulously planning your design, your method, your approach, laying out your propositions and really thinking about how your data aligns those propositions and pattern matching. So much more quantitative in his lens. And then you've got Miriam, I'm going to say, is that middle ground in between them. And she is much more qualitative, but does have much more of like a description of the how-to approach to case studies, whereas Stake is going to be much more philosophical in his writings about the case study. So I would say each one of these three methodologists, if you're new to case study research, would be worth buying their textbooks. So again, they're typically written in textbooks, and there's lots of other papers that you can find in the research as well. So I won't go and do tons of comparisons across the two. I'm just going to start right now, and then the rest of this talk, I'll just have to state right up the bat, I'm most familiar with Yin, and what I'll be talking about and presenting at is from more of a Yin perspective, but I'll be alluding to how to Stake along the way as well. So Stake comes from program evaluation. He is well respected and known in the world of program evaluation, and he sees case studies as qualitative, and he writes and describes them from a qualitative perspective. He takes a constructivistic epistemological lens and orientation in all of his work. So if you're unfamiliar with that, it's epistemology is, how we understand where knowledge comes from. And so thinking about constructivism, it's this notion that knowledge is socially constructed, and that the researcher, their role in that type of work is that you are part of the research. So like you are intimately connected with the way data is collected, the way it's analyzed. And so you're not a neutral sort of observer, but you're part of that research process. Yin, on the other hand, he actually never explicitly states his epistemological orientation. I think we can allude to it and understand it because he talks in much more of a sort of post-positivistic perspective. So he's much more about quantitative data and qualitative. He talks about mixed methods and collecting lots of different data. And again, he uses much more of this idea that there is a truth and an answer in this world, and that by collecting multiple sources of data, we can triangulate that data to come up with an understanding of the phenomena that we're interested in. Whereas that is not Stake's sort of perspective at all. And again, mixed methods. I would say he's personally a pragmatist. That's what, if I had to say anything, I feel like the way Yin goes about it, it's about trying to understand a problem that stems from real life, trying to get multiple different data points and trying to action those data points, and as a result, which really is that pragmatic lens. And then Miriam, she is a much more constructivist as well, and qualitative. So oftentimes when people say case study research, and again, this is not how I think about it, but this is how many people, if you say you're doing case study methods, people will automatically assume you're doing a qualitative project. And so I just want to kind of debunk that for everyone who's here. I mean, there are definitely qualitative case studies designs, and there's no like value judgment about that. But there's also lots of different case study research designs that are mixed methods, and some just use quantitative data. That would be probably rare, but there's those times. And so the biggest and most important thing to do, and I see this all the time in PhD work, is this notion of binding or putting a boundary around the case. Like, so articulating what is in and what is out of the case. And this is the most difficult challenge. And again, I think the compelling piece at first of case study research is like, it seems simple, but I'm going to say it's some of the most complex designs because you're grappling with so much different data points. I would say more complexity around the questions you ask, and just trying to figure out like, what do you consider your case? And we'll walk through different designs here. So I've just put 3 different descriptions of what the context is according to the 3 major methodologists in the field. So Yin is this idea that it's a phenomenon in a real life context, And again, where the researcher may not have control over the phenomena in that context, partly because there's just so much sort of real life messiness with it. So it's hard, again, if you were thinking of like an RCT design, hard to fully control. So you're in the mess of the real life context. Stake is a little bit more laissez-faire. It's something about a system, it's bounded working parts, but maybe less focused on sort of specifically talking about boundaries, but still this idea about what a case is crucial. He's much more interested in programs and people. Again, he comes from program evaluation than anything. And Miriam is, again, the most focus on like, how do we bind this case? And she sees a case, it could be a person, a program, it could be groups, a policy could be a case in terms of how a policy is implemented as well. And again, from like health systems and services research, thinking about policy implementation and where that influences a bounded group, I think case study designs work really well. So I also wanted to say a case study is not a case history or a case report. And I just put this up here because I think people also confuse this with medical case reports. And so I just took this definition from the NIH just to kind of remind ourselves that, again, a case report is much more about like a patient perspective and describing like an individual patient case. That's not a case study. So I'm just going to stop sharing for 2 seconds. And I just thought before I go on, just wanted to reach out, and if anyone wants to share, if they're in the midst of doing a case study design, if they're thinking about a case study design, or if they're thinking about like what could be a bounded case that they might be interested in studying. No pressure here. I just thought I'd stop and see if anyone wanted to share any work that they're doing right now.
Hey, Catherine.
Hey,
It's
Jordan.
Jordan here. I guess one thing is less about work in progress and more about like, ideas that are bouncing around for future thinking. I've really been thinking about the value of case studies for process evaluations in other forms of research, and thinking about oftentimes when we're thinking about how does an intervention or a model of care interact with its context, there's often a bounded case that kind of defines that, and that it provides a really interesting lens. And I haven't in the past for our cluster trial work and that kind of thing, haven't framed my process evaluations that way. But it's actually as we're grappling with the data that it starts to actually look like a bounded case as we're like analyzing it. And so anyway, it's like you learn as you go scenario for us, I guess, around like, oh, actually this would have been a great way to actually frame our process evaluation. So anyway, just thought I'd share that as in case it's something that resonates with others around that this idea that actually this could be really helpful, I think, embedded within other work.
And you know what? It's funny you say that. I'm going to bring this up in a little bit. I was reading about, I don't know if people know of Fetterman. I'm going to share some other methodologies coming up. And they presented something called exactly what you're saying, a mixed method case study design. And so it's actually a case study embedded in a larger study, just what you're saying. And so like I hadn't really conceptualized case studies to be used like that. But as I was reading, I'm like, well, that is like I can see just for exactly the reason what you shared. I was trying to think of like what an example could be. So that's one.
Yeah. I think just to give trying to do the qualitative component of our process evaluation across multiple sites, we were finding it really hard to actually take a reflexive thematic analysis approach because a lot of the experiences were so unique to an individual context. And then it got us thinking, well, wouldn't it have been nice if we would have planned data collection for each of these sites, therefore, to be able to have enough data to think about them each uniquely. So
yeah, no, that's interesting. Nicole, I know you have used case studies. No pressure.
Yeah, I was just I'm in the midst of a case study now, or a multiple case study, looking at the process of delivering brain health screening in community organizations. And one of the things we grappled with was if the case is a process versus the case is a site. So when you talked about binding, I think we had lots of discussion around, well, the process is actually the screening process that is conducted within these specific community organizations. And so, but we often talk about cases as actual sites or organizations, but we wanted to actually study the process, which, and so we had lots of these conversations, I think, during, my PhD, and at what point does it matter? Does it not? But just thinking about when you talked about the different types, what can be cases and how can they be bounded? If the case is a process,
yeah,
just looking at that language and making sure all the partners know, because the sites, our community partners, are the cases because they know the context. So I don't mean to, I think these nuances about what is a case and what is a site and what is the context, that you can't do the process without the context. But is the context the case?
I love that you brought this up, because this is exactly in 2 slides from now, just entangling the exact thing of the context versus the case. Because I think that's actually the struggle for people. Because I was just I've been on a few proposals lately, and I can see the struggle between the case and the context, the phenomena that you're actually researching, which is the case study.
Yeah. I think it just takes some time to unpack and make sure that everyone understands, what exactly we're studying, because it then helps with binding the case and who's actually included if they're not, are they healthcare providers that aren't included within the organization and how, or policymakers within the, within the province. So
Yeah. Yeah.
um,
No, that's great because I'm going to walk through 3 examples actually from the literature that I've been involved in too. So I think these are like both of your examples right now are exactly what I was hoping to dig into. So, okay, now that we're kind of like there in terms of what cases are and not, I wanted to go dig into some of the context of cases now. So again, Jordan and Nicole just have spoken of 2 different ones, like a community partner. So I'm going to say you can, for those of you who know that I work with naturally occurring retirement communities, NORCs, I mean, that is why case study research is so lovely because each retired NORC is a bounded case. And again, context is so important in understanding like how programming looks at each of the different NORC environments. Each primary care practice, and I know that people are on the call who've done this as well, like case study designs are so wonderful because each primary care practice can have its unique elements. And again, digging into how different programs are implemented in different sites is like hugely important to think about, again, from that process evaluation. Morgan's on the call here. We've done a case studies where we think of each Ontario health team and again, binding it around an Ontario health team being a case. And you can see how nicely that could go with 58 different health teams. And again, how you might start to compare and contrast different OHTs, hospitals, hospital units. I'll give an example of that. I've done case studies where policies implementation across provinces are considered sites. So I've done one where we looked at Alberta, BC, Quebec, and Ontario, the implementation of a policy. So again, a case we'll get talking about how you bound a case. And I think I created this little visual, I just made it myself, but this is from Yin's book, informed by that. And so I'm just going to walk us through here because again, it seems easy to start with until you start to like really unpack it and start to talk to your community partners and as students kind of talking to yourself about like how am I describing this in my proposal, for instance, or as supervisors, how you help your students to understand this. So the most straightforward is a single or holistic case. And I'm using different terms because different methodologists say things differently. Oftentimes, again, I'm going to call it a single case. I'm going to use the example, Nicole, of yours right now. So the context was a community partner. So that's the context. But the bounded piece in white, or the case, which is really what the unit of analysis that you're interested in, would be I'm just going to say the screening process. Is that what you said, Nicole? The
yeah,
screening process.
we're screening for dementia in people with intellectual disability.
And so that's how, again, I like to frame this visually, just like what you're saying. There's the context, and then what you're actually saying is the case and of interest. And that's when I think it's helpful to think about, like, what's the phenomena you're studying? And I think that's that unit of analysis. So I think, Jordan, in your case, in my mind, the context would be the primary care teams, and then the unit of analysis is the process in which the RCT, like the intervention was given. And so then you can get to multiple cases, multiple holistic cases where you've got, again, for Jordan, I would say he's going to be working with, say, 10 different primary care teams. So he's got 10 different primary care contexts. And the case in each one is going to be like, how did that process implement the implementation of the intervention? So that process evaluation, how does that look for each of them? So understanding the different contextual factors that are at play. Then you've got the next more complex ones where you've got embedded cases. And this is where it starts to get like really tricky to think about what's data that's feeding into the holistic case and what's uniquely bound embedded cases, because then you have to do another set of binding. And so this is where things can get complex, and just, it's good to have a team of people kind of to talking yourself through this. So I'm going to share an example of like a single embedded case study. I haven't, the the multiple embedded case studies can get very complex, and you can imagine you're getting lots and lots of data coming in, and you've got to organize that and figure out how you're going to analyze that. So again, for this, I'm going to use the example coming up where the context was an acute care hospital and like a post-surgical unit. And the case was looking at how an evidence-based post-surgical mobility guidelines were implemented. And then the embedded cases were the individual patients and actually their activity patterns. So again, gets confusing and complicated and lots of data to manage. So then a multiple case study would just be like, you'd have multiple of those hospital units that you'd be looking at across. I think the one thing I want to mention this, and I think this is what, again, people have a hard time grappling with, and I see it in the way they talk about cases. They talk about sampling, but sampling is your participants within the case. So if you have multiple cases, it's replication logic. So your cases aren't new samples, but they're replications of the same study design, and that you sample within the case. So for instance, you're going to do sampling within the case. Say you're doing interviews, you might use purposive sampling to have like different perspectives that you're using from an interviewing. So that's the word sampling is within the case. But when you have like multiple cases, it's not another sample, the case is another replication, you're replicating that design again. And that becomes important when we think about, people will say, oh, they're not generalizable. But this idea is if you have multiple cases that you've actually been replicating that study design. So gets to that notion of more of generalizability. I'm going to stop there. Does that make sense to people? Okay, I can watch the chat too. So if you do have questions, just let me know, or just by all means unmute. So this is, Jordan, I think what you were talking about. And I'm just going to say this is a great article. So these are two, I'm not going to say they're the core methodologists for case study design, but these Gutterman and Fetters are core mixed methodologists. And so they have done a lot of writing on case study designs, because a lot of case studies use mixed methods. So their writing comes in actually more the analysis than anything, and how you actually bring all your data in case studies together. And Adana will be talking about this in November, because this is the biggest challenge of case studies. And this is why I think it's important to have a good understanding of what we're talking about in terms of the designs, because of the data that you get at the end. So a typical case is the one on the left, and that's where you have a case study and you have multiple quantitative or qualitative component. That's traditional. That's what we're really typically talking about. But what they introduced is what Jordan spoke about, that he has a randomized controlled trial that has this quantitative component, but he might want to also add a case study to look at how was the process of implementing the intervention. So anyway, I can forward this to you, Jordan, because I think this is a really interesting article. So now all the different types of case studies, this is where it gets a bit overwhelming in my mind. So there's explanatory, kind of the how and why, a descriptive, and then exploratory. Again, I'll give you more if people are interested in reading more. And then it's trying to find what kind of cases that you want to study. So a critical case is considered more from like a theoretical, like looking from a theory perspective. An extreme or unique case, there could be something where, and I'm going to say there's a really unique case in Napanee in primary care where there was a group of physicians who used to be fee for service, and now they've moved and they've become a team-based model. And so that would be a very unique case in which that a case study design would be fascinating to study, the transition of patients going from, as a whole panel, going from a fee for service, no team, to becoming a team. And like, you can imagine all of the different pieces that you might want to explore. So that to me is like an opportunity to use case study design. And that's something like locally here in our region. that would be a great example where you could use ICS data, for instance. You could look at ICS health utilization sort of before and after the case shifted, for instance. So anyway, there's lots that you could do in these unique cases to understand. A representative case, and again, we use these a lot of the times where we just want to understand this phenomena. It's not anything in any sort of like different reason. It's just like we want to understand this phenomena as it happens every day. And so I'll talk about some examples of that in a bit. And a longitudinal case, that's what Vince and I are using when we're looking at OASIS. We're studying 6 naturally occurring retirement communities with OASIS, so 6 NORCs, and we're following them over 5 years, and we're looking at each of those cases as they develop over time. And a contrasting case, that would be when you have multiple cases, when you're trying to look at differences. So you might look at, for instance, you might look at, I don't know, I'm thinking like the implementation of diabetes management programs. You might want to look at that in a team model of care and a non-team model of care and compare and contrast what that might look like. I've put Stake here. He uses different words. He uses instrumental and intrinsic case. So again, like kind of picking your methodologist and working sort of along their terminology. So again, like when you consider your topic, I would say Jordan probably is using representative cases for the most part. Like he's probably got a range of different primary care clinics, but for the most part, they're fairly representative of team-based primary care. They're not necessarily extreme or uniques. And I would even suggest, Nicole, you're probably using representative cases. I'm just now picking on the 2 of you because you spoke up. So I'm just going to stop sharing and just take my slides off just for a second, see if anyone has any questions. And so Jordan's also brought something that I'm going to talk about in a second about theories, because especially from a yin perspective, again is much more about thinking about mixed methods and sort of a positivistic perspective. So yin is very much about what is your theory? How does the theory guide your propositions, what you're expecting, and how do you take your data and really pattern match to those theories and propositions? Okay. I will go back to the slide. Sorry, it's just, I don't know if everyone's keen to hear me keep talking, but I've got lots of things we can talk about with case studies. So I thought I would take 3 different studies that I've been involved in. And you might recognize yourselves on these from in the call here, but I thought I'd pick them because they've all been published. So you can actually go back to the literature, and some of them have multiple publications around them. And I've also wanted to pick them because it's hard to fully publish a case study design, because oftentimes what happens is you don't even know that they're case studies, because what happens is researchers, for lots of good reasons, dismantle them and will publish components of the case study. So they might publish the qualitative interviews that came out of cases. They might publish the quantitative survey data or whatnot. So again, because there's so much data to grapple with, sometimes word count and publication, you can see these were all BMC and open access, so they have large word counts. So that's why we were able to publish them here. So I'm going to now just talk about yin and just be thinking about these. And this is how I've gone about my work from a mixed methods perspective. And so Jordan spoke in the chat. He used the CIFR, which is basically an implementation science framework that's heavily used in the literature and very helpful. So thinking about how that theory is informing your work, thinking about the research questions, and the propositions are essentially your hypotheses. So Yin says that you should look to the literature, look to theories, and actually state what you think that you want to be looking for that's coming from what has been written. And that really will help you once you start to make sense of what your findings are. So multiple sources of data. So oftentimes there's lots of documentation that people use, program documents. They'll use interviews, observation, physical artifacts, lots of different things. And I know there's people on the call who've used a number of all of this. versus, and I know sound like I'm disparaging steak, and there's lots of great work and a lot of work that people do using from a steak perspective, but I always smile because instead of Yin saying you've got to have all of this preparation, which again, I think that's really helpful as supervisor helping PhD students work through the process, being much more sort of planned out, whereas steak says there's no particular moment when data collection begins. So he is much more of a constructivistic person, and things sort of flow from the interaction with the people he's working with versus sort of this planning. So I'm going to explain one. This was actually part of my PhD work, which is, I apologize, it is a bit older now, but I think it's still a good example. So this is kind of getting at Nicole's idea of like, it was a process in some ways that I was looking at. So I worked with a memory clinic at an interprofessional primary care team. So the family health team and the memory clinic was the actual context in which the study. So it was a bit of like a nested design. So I actually did an evaluation of the memory clinic, and the case study was actually the case study was a research of the process they were engaged at of the evaluation. So it's kind of like a little mind bender. So there was like multiple layers there. So I did an evaluation. That wasn't my research. My research was on the evaluation process itself, and the findings were just a different piece. So I actually used what I called a knowledge translation informed evaluation. So all throughout the evaluation, I was bringing in literature, and we were iterating and developing the memory clinic as we were going. And so that evaluation informed sort of people's understanding of the memory clinic, understanding of the research around memory clinics, and sort of the practice themselves. And that's what I actually studied. And so the theory I used was an evaluation theory called the pathways of influence. And so the objectives were, how does participation in an evaluation influence members of the program, the behaviors of the program, and the organization as a whole? And so the pathways of influence had these 3 layers. And so I used the theory to influence my objectives. And then I also had propositions based on the theory. And so we don't have to get into the nuts and bolts of these, but it's more just to show you that you need to be thinking about the context, how you bind it, what theories inform you, and then what you imagine might happen based on either theory, a framework, or some sort of literature. And so again, what Yin also suggests is once you have your propositions, that's where you lay your data collection over top of those. So you can see I used surveys, I used interviews, and then this was my data collection. This is from the study itself. And so it was a longitudinal study. So we had assessments. And again, the data itself, we couldn't analyze from like looking at statistical differences. It was much more descriptive because it was a smaller program. But it was, again, more to collect like multiple sources of data so we could understand what was happening over the course of this 6-month evaluation. So again, the data collection aligned with the propositions, which aligned with the framework. So I'm just going to go through 2 other examples, again, not get into the weeds of what the study was, but more looking at the methods itself. So this second one was a multiple case study. And so it was exploratory, and I'm going to say it was somewhat contrasting. I was trying to decide what I thought about this, but I specifically, this was at a time, and I say it was exploratory because nothing had been done like this before. So we were looking at interprofessional primary care clinics. Occupational therapy was for the very first time getting implemented in family health teams. And so we had no idea what that was going to look like. So this was very exploratory to help us learn to figure out like how and in what ways is occupational therapy being integrated, and trying to understand the structures and processes at each of the different teams that supported that integration. So we chose family health teams and we replicated in different contexts. So there was one context that was an academic family health team, another context that was a rural family health team. And so again, we took the same methodological approach, the same approach to data collection, and we replicated at each of the different family health teams. So each one became their own unit of analysis. And so this is where, and again, I'm not going to steal Adam's thunder, but this is where you get into two types of ways you'll look at the data. You'll look at within case analysis and then cross case analysis. So you'll look at and understand each of the unique family health teams, because that is one specific research implementation. And then you'll start to look at the data across the different contexts and different cases as well. So cross case analysis. So for this one, I use the collaborative competency framework. So that was the sort of the closest thing that I had to help me understand this process of like what helps support collaboration and integration. And so again, looking at what I felt from the literature in that framework, knowing that how people work together was about structures and processes and understanding. And this idea that we knew from the literature that having a common EMR was going to be pivotal to supporting the integration. So again, we used lots of different data. We interviews, documents, like surveys, job descriptions, websites. And again, I don't want to go into the analysis here, but this was just like one example of how like we had 4 different cases, and we started to think about how we present them individually as unique sort of from a replication perspective. And then again, the actual paper, if people are interested, you can see how all of the data was brought together in the results section. But this is an example when you have multiple cases, typically you present them as individual cases, and then you also merge the data for like a common sort of understanding across the different cases. Okay. Just where I want to be. So we've got about 15 minutes, so I'll just share this last example. And so this was a complex study, and I must say this was done really well, and this is a lovely paper to take a look at. There's not that many examples of embedded case study designs that are written completely in the literature like this. And so this was Lynn Haslam-Larmer. She was a PhD student in our aging and health program, and Vince was her primary supervisor, and I was on her committee. And so this took a lot of work to distill down to this design. And so what she really wanted to look at is she was a nurse practitioner and had worked in this hospital and was really interested in, you know, how do people implement these like early mobility standards and protocols. And so what she realized was what she wanted to look at is understand, you know, how the clinicians on the floor, how they learned about the protocols in terms of early mobilization post-surgical. And then what did that actually look like? What was their attitudes? And then how did the patients on the floor, like what was actually their function and their actual mobility movement patterns on that floor? So you can imagine how interesting this could have been to do a multiple embedded case study design. So imagine taking another hospital or another unit on that hospital. You could choose something like that. So again, her interest was post-operative early mobility and the implementation of guidelines. And she used the theoretical domains framework, again, thinking about a knowledge mobilization framework. So she wanted to look at early mobility activities who had a history of recommendation implementation, and then identifying factors that influence participation. And she had a very lot of data. So again, her propositions, again, based on theory. So she was thinking that early mobility activities would be limited, that pre-fracture function would predict outcomes after fracture, and that notions of mobility would influence subsequent mobility. So how people thought, you know, people are often hesitant to get people up right away after surgery. So again, sort of knowledge and attitudes. So she collected a very lot of data. So she did interviews, she did chart audits, chart reviews, again, interviews both with providers, patients, and families. And she used something called the Active Pal and also behavioral mapping, and actually observed people's movements and actually did activity trackers and watched activity trackers. She also looked at unit documents as well. And again, I had a lot of data, and I'm going to say this is the challenge, particularly as a PhD student, or really for anyone, is how to grapple with the data and make sense of the data. So again, I've purposely put the data collection linked to the propositions so you can start to think about how you might map some of those results. And so this is the visual of her study here. And so you can see her main case was the hospital unit. So she had certain elements that she wanted to understand about the context of that unit. So she did a number of interviews with providers to get their understanding both of guidelines in terms of implementation and their knowledge and attitudes, and looked at a number of documents as well. And then each embedded case was a patient. So she did interviews, she did monitoring, and then she looked at patient records. And again, her paper is very, very interesting and a great example of a complex study presented to understand how context influenced her results. So I guess I just want to end, and we've got a few minutes, about 10 minutes for conversation. Yin, the idea, people automatically say that case study designs are not generalizable. And I guess Yin would sort of push back and say this idea is that you have propositions, hypotheses, that you're trying to enhance internal validity through this idea of like logic models, sometimes through pattern matching, and external validity through this idea of replication and having these multiple cases as sort of like a stronger design to think about how your results might be generalizable. And then stake, again, is much more interpretive. And this idea is really much more not about generalizing, because it comes from a qualitative interpretivistic paradigm, but this idea of much more about sense making and using words around more trustworthiness versus this idea of validity. So I'll stop there. Next month is diving into analysis, which I will say is the most complex piece of case study design. And Nicole's working with me as an Adanum and a few other PhD students, and we're actually in the process of doing a scoping review, and we're looking at methodology papers, case study design methodology papers, and we're specifically pulling out the analysis piece of it, because there's actually been no paper that's actually just been written on the analysis of case study methods. So we think it's something that, we've been struggling with ourselves as a group and just trying to figure that out. So I will stop talking there. That's 10-2. And just open it up for any questions, and just even using the larger group to bounce ideas off of.
Catherine, can I just jump in for a second? Just a couple of thoughts. One, I think that having experience with Yin and as a learner in my PhD, it was really helpful to have that structure. So just as, if we're thinking about students or first time into case studies, it just provides a little bit more confidence and structure, I think, to gathering a large amount of data. And often, as you mentioned, mixed methods data. And what I also felt aligned with Yin was this idea, and you spoke about it before, but pragmatism, because I think as coming from more of a qualitative bent, or like kind of leaning in my work, in his later writings really talked about, although he started in a post-positivist lens, really is about pragmatism, and it really aligns with mixed methods research and those paradigms. I think really it doesn't preclude working out kind of a constructivist paradigm or a realist paradigm. So just wanting to say, I think it actually find much more inclusive and kind of offers structure for people just entering this, and also to be able to talk about rigor and quality. Couple of thoughts.
Yeah, I think I agree with you, because I feel like And Stake hasn't really written, like, his textbook, his seminal textbook, for people who may not know this, is from 1995, which, you know, he hasn't I'd love to know what he'd be thinking now and adding more to the work, because we just have that book to really go on. And so I think probably there's been so much movement and thinking around that. I'd love another update. Like, Adanam, you have a group that get together around case studies. Like, I'd love to hear some of your thoughts and conversations around that.
Yeah, thank you so much. I think this is very helpful to uh, attend this presentation. It's really great because case studies are really one of the most versatile kind of approach. You know, they're practical and you can collect data from multiple sources. And especially if you are planning to do something that could be acted upon, something that changes, you need to understand the context very well. And also you need to have information from multiple sources because the implementation of a certain program depends on a lot of factors. So I believe case study is the best way, especially if you have a program to implement or if you are evaluating a certain program. And also the boundary of the case and the context will give you something that's easy to work with. So we're learning on how to best approach case study methodology in general and also the analysis part in particular. So yeah, it's really great to listen to these conversations.
I don't know if anyone else has any sort of things they're grappling with that, you know, we could bring to the larger group here, or if you're interested too, we've got quite a few sort of these key methodological papers if people are just starting out doing case study designs as well. Oftentimes I see that people are actually doing a case study and they just don't realize they're doing a case study as well. And so, like, they might be doing very sort of contextual work and bounded work, but, you know, not necessarily articulating it in that way.
Yeah, I think one of the most interesting thing about case study is you can do a qualitative case study, quantitative case study, or it could be a mixed case study. And some even consider it as like there's a qualitative tradition, there's quantitative tradition, and there's case study as its own unique approach. And so it's really because it can include like a number of kind of approaches. Some even see it as a methodology by itself. So
yeah, no, that's actually a great point. Like, oftentimes, especially if you think about the qualitative approaches, case studies is considered its own unique, although sometimes it's, like you said, it considered outside qual and quant as it's separate. Well, it doesn't sound like there's any specific questions, so hopefully I presented it clearly then, or not. But Adanam's going to talk and dig into the analysis, which I think actually is really the interesting piece. So today, hopefully, was just kind of level setting us, getting us to next November's Methods Monday. So November, I think the 25th at noon